how do we treat patients who come with heart failure?
Excellent question. I think most people are not aware of it. They think heart treatment means angioplasty or a bypass. But today, heart failure is a bigger burden, and there are fantastic therapies available to it. There are two kinds of heart failure. One is acute heart failure, means a person's heart function was apparently okay until about 2-3 days or a week. Now it has become very, very weak and not able to generate even the blood pressure. These are acutely sick patients who are kept in the ICUs. Today we have many equipments which can do the same work as a heart. Even when heart is stopped, the blood circulation is still carried out through an external pump. These are called artificial hearts, or what we call ventricular assist devices, VADs. Today, I think recently there was an article in the newspaper. A person was put on this for 100 days. Heart was just relaxed and the machine was pumping for her for 100 days. And then she underwent a subsequently heart transplant. So for acute heart failure, there are intra-aortic balloon pumps, and the ventricular assist devices, or CentriMags, or ECMO. There are many other things which can do the job of the heart for a short duration of time. When these people don't recover, then we can put an artificial heart, not another transplant, not another from another human being. Now there are new heart machines which pump the blood like never before. You can even arrange the amount of flow that you need. So if you want to exercise, you can increase the flow, and they can live. Currently there's an Indian patient who's living on this for last 10 years. So these are fantastic devices which are available. Most of us are not known. These are called ventricular assist devices. But on a chronic heart failure, means somebody who survived a heart attack, underwent an angiogram, angioplasty, and a bypass, and now 20 years over, his heart has become very, very weak. But lungs are good, he's got a good productive life for another 10 years or 15 years, then heart transplant is a fantastic option. And it's as simple as probably to perform like a bypass, but then he needs to have a close follow-up to preserve this transplanted heart. Like we all know, everybody gets a kidney transplant, but most of us don't know that heart transplant also can be done and people can live fairly well after that. So at the end of year, I think at least 90% are living. At the end of 5 years, at least 70%. And at the end of 10 years, more than 50% still survive on these heart, transplanted hearts. But if the transplanted heart fails, then we have external devices, machine, which does the same job as the heart. So these are called artificial heart pumps, or called LVADs, left ventricular assist devices. Third, the current new generation one works on a maglev mechanism, means magnetic levitation. No part touches each other, so there's no wear out on these. It's on a magnetic, philosophy. So their longevity is, really, really long. But who are the people who die most often from heart attack and heart failure? Apparently normal-looking people. You would hear that until yesterday he looked fine, and suddenly they said he died. I mean, it's shocking to most people. It's very important to know, after a heart attack or a heart failure, the risk of sudden cardiac death. There's an entity called sudden cardiac death. A person who was apparently fine of a heart disorder patient suddenly dies. What is the cause of this sudden death? In 80% of the time, it is because of what we call tachycardia. Heart beats too fast. Instead of beating 60 to 120 times, it starts beating at 300, 350 times when it cannot effectively pump but just quivers. When blood is not coming out of the heart to supply the brain and they lose consciousness. And if somebody does not do CPR and shock that heart to break from that multiple quivering to start contracting again, they will die. In most of the advanced countries, you could see that lightning signs and defibrillator in the airports, in the cinema halls, in malls, bus stands, everywhere. But unfortunately, in a country, I think many clinics also don't have it. Forget the public places. So for such patients, when the heart pumping capacity becomes less than 35%, as I told you earlier, normal ejection fraction is 55 to 65%. But once the pumping capacity falls below 35%, these are the people who are vulnerable for sudden cardiac death, which can be reduced by more than 50-60% by implanting a device, pacemaker-like device called defibrillator. It's a very intelligent circuit, sits here with a wire into the heart. If ever his heart starts beating too rapidly, it can sense and shock it and reset it. And if it stops, it can re-stimulate it to contract. It's called an automatic implantable defibrillator cardioverter. So ICD is a fantastic tool, but most of us don't know and don't seek it. Third, there is another condition called left bundle branch block. In this case, heart, instead of coming together synchronously, one wall contracts first and the other wall contracts later. This dyssynchrony decreases the efficiency and heart goes on dilating, decreasing its pumping capacity, and patients die. In these people, we put a pacemaker-like device called CRT, cardiac resynchronization therapy, where we can stimulate both the portions together to contract so that it becomes synchronous to improve the heart function. I mean, that's our area of specialization here, heart failure treatment. It's a very specialized, very advanced therapy that we offer. It requires proper understanding, assessment, and very tailor-made therapy for each of the patients. Not like heart attack where angioplasty bypass is for everybody.